Hello, you're tuned into daily coronavirus updates. You're watching The Wire, and today is the 25th of May. India registered its biggest single-day spike of COVID-19 cases for the fourth consecutive day. 6,977 new infections were reported in the last 24 hours, taking the country's tally to 138,000. With this spike, India is now in the top 10 worst affected countries by the pandemic, overtaking Iran, which has seen 135,000 cases. At the current rate of increase, India is likely to overtake Turkey in another 4 days. Nagaland, which was free of COVID-19 infections so far, reported 3 new infections in the morning. 3 people had returned to the state from Chennai. Bihar has reported 180 new cases of COVID-19 from 15 districts, pushing the tally to 2,574. Workers at 2 of India's biggest car makers have tested positive for novel coronavirus days after restarting operations. 3 employees at the Hyundai Motor Company's India plant have tested positive for the virus, and 1 employee at the Maruti Suzuki plant in Manesar has tested positive. Delhi has been seeing a sharp rise in cases daily, and the Chief Minister addressed the media today. He acknowledged the sharp increase of COVID-19 cases but said that there should not be too much concern, as neither the cases are serious nor the incidence of deaths are rising sharply. He added that 10 private hospitals in the city have been declared COVID-19 hospitals, and 20% beds in hospital and healthcare centers with 50 or more additional beds will be reserved for COVID-19 patients. Kejriwal said that the situation is under control and there is no reason to worry. He added that cases were expected to rise with the relaxations in the lockdown, and people of Delhi need to only worry if the recovery rate is going down and if more people are dying of the disease. Domestic commercial flight services resumed today after nearly 2 months' break due to the COVID-19 induced lockdown. The resumption was marked largely by chaos created in the aftermath of several flight cancellations and many airlines and airport authorities failing to inform passengers of it. Nearly 80 flights which were meant to leave from and land at Delhi airport were cancelled on the first day. Many states like West Bengal, Tripura and Andhra Pradesh had already said that they would be starting flight operations at later dates. In an interview to The Wire's Karan Thapar on Saturday, Dr. Randeep Guleria, the director of AIIMS, agreed that it's too early for India to claim victory over COVID-19. He said that the next few weeks and months will be most challenging for the country. Dr. Guleria admitted that the 4 lockdowns had not flattened the curve, unlike Italy and China, which saw a declining trend after lockdown. He also added that the curve is not as steep as the government had feared it would be. Link to the full interview is in the description below. The Gujarat High Court severely criticized the Vijay Rupani-led BJP government for trying to artificially control the COVID-19 epidemic. The court termed the civil hospital in Ahmedabad as good as a dungeon, maybe even worse. Gujarat has so far shown one of the highest COVID-19 death rates in the country. A division bench, while hearing a PIL on a range of issues relating to COVID-19 response in the state, said, "It is very distressing and painful to note that the condition prevailing as on date in the civil hospital is pathetic. We are very sorry to state that the civil hospital Ahmedabad appears to be in an extremely bad shape. As we said earlier, the civil hospital is meant to treat patients. However, it appears that as on date, it is as good as a dungeon, maybe even worse than a dungeon." The bench likened the poor state of infrastructure to the sinking of the Titanic. The Maharashtra government has asked Kerala to send 50 specialist doctors and nurses to treat COVID patients in the state. In a letter sent by the Directorate of Medical Education and Research to the Kerala Health Minister on Saturday, the government asked for recruitment of these doctors and nurses on a temporary basis. The BMC has also reached out to an association of nurses among other agencies seeking to appoint nursing staff in civic hospitals in Maharashtra. On Sunday, the Union Health Minister Harshvardhan said that 4 of the 14 COVID-19 vaccine candidates from India may enter the clinical trial stage in the next 3 to 5 months. Right now, they are in the pre-clinical trial phase, he said. The Department of Biotechnology has been made the central coordination agency to identify pathways for vaccine development in the country. The PM CARES Fund Trust has also decided to allocate 100 crore rupees in efforts to develop a COVID-19 vaccine. That's all for today. You were listening to COVID-19 updates from the 25th of May. To watch more videos from The Wire, click on the subscribe button. Thank you for watching. We will see you tomorrow. Until then, stay safe.